Hi, I'm Dr. York Yates. Welcome to my practice. I'm a board-certified plastic surgeon operating in Layton, Utah. I've been here since 2003. I'm from Utah. Utah's home. That's why I'm here. When I went away for residency, I went to Missouri for 6 years for my plastic surgery residency. Became a board-certified plastic surgeon and came back home. I love Utah. I love the mountains. I love the people. And honestly, wouldn't change a thing and haven't for 20 years. I've been in the same building, the same practice for 20 years, and I plan to stay here for as long as they allow me to. One of the reasons I came back to Utah was my dad. My dad's a family practice physician. He was here at the Tanner Clinic where I practice, and I got to practice alongside him for 15 years, and it was quite the blessing. So, super happy to be where I'm at. My practice has evolved generally over the years. I started out doing general plastic and reconstructive surgery. Now I do cosmetic surgery, and specifically of the breast and body, that being what we call mommy makeover surgery. I didn't know when I started my practice, but I happen to live in the epicenter of mommy makeover surgery in Davis County. It's super popular here. There's a lot of women that have had babies very early in life. They have lots of babies, and generally they just want their bodies restored. And over the years, my practice has evolved to allow for that, and I'm grateful every day for what we get to do. Over the last 20 years, I've done well over 10,000 major plastic surgery procedures. Most of those being breast and body surgeries, although not limited just to that. About 95% of our patients are female. About 5 to 10% of them are male. Having that much volume and that much experience, and really being able to just focus on those limited things that we offer, helps me and my staff just be excellent and just provide consistent and solid care. Paying attention to safety, major factor for me. Safety is number one always. Paying attention to results, offering innovative technologies, and just having experience, just for me and my staff, just to do so many of these procedures that we can really do them excellently and get patients through them with minimal pain, minimal recovery. A few things that we do in my practice that might set me apart. Over half our patients don't take any narcotics, and super proud of how few pain medications our patients need. Again, most of them need no narcotics. We do a lot of things to make that happen. That just doesn't happen by accident. There's a lot of things we do before surgery, during surgery, and after surgery to prepare them, get them through that surgery precisely, and then things for after surgery to make it so most patients don't need narcotics. That really helps a ton with risks. It helps a ton with just their experience, their recovery. They're more likely to send patients to us because they're happy and they get through things easily. In our office, we do a unique kind of anesthesia. It's called TIVA, T-I-V-A, total IV anesthesia. It's basically somewhere right between a general anesthesia and wide awake. It feels to the patient like a nap. There's no paralysis of any of their muscles. There's not a breathing tube. Really limits some of the risks both during surgery and specifically afterwards, that easier recovery, lower risk of blood clots. In fact, really low risk of blood clots in my practice. And that's something we're really proud of and something I wouldn't change. It's a very nice experience. And most patients that are really nervous about nausea or pain or things after surgery wake up and say it was much easier experience than they were expecting. A few other things that we do for my practice, where we specialize so much on mommy makeover surgery. Tummy tucks are a big part of my practice, and the vast majority of those get done without drains, which if you know anything about drains, they're not terrible, but you'd rather not have them. They're more comfortable to not have a drain. A little easier recovery, nothing to take care of there, nothing to manage, a little bit easier. Also, we do a lot of breast surgery. We do a lot of breast augmentation, breast lifts. With our amazing 3D technology, we can show results of those before. Patients love it. They get to see the result, they get to see what they might look like, experience the experience before it, and maybe we even fine-tune what they'd want to choose and what they'd want to do and not do. It really helps me with communication, make sure I'm on the same page with my patients, and it's something we've been really happy with, and I've been doing for the last 16 years with every single consultation for implants, and it really helps us to be precise. I'm very proud of our communication that we have with our patients. Not only just my staff, which I should touch on as well, but just what we do with patients for after and even before surgery, preparing them for surgery, getting them ready, and then afterwards. I give every one of my patients my cell phone number for 24/7 access to me. Essentially, I'm always on call, always ready for my patients. We also have a special app. It's pretty amazing that gives us ability to talk to patients real time, either by video or text chat, HIPAA secure communication all the time, and my patients really love it. It's a really nice way for them to be able to get to me, and it's a nice way for me to be able to address issues before they become bigger issues. So it's very helpful. Speaking of my staff, I couldn't do any of this without them. They're amazing. They're all really wonderful people. You'd be surprised to know that a good majority of them have been with me almost from day number one, and that's 20 years. So we've got a really loyal staff. They believe in what we're doing. They really love our patients the way that I do, and our patients love them. So if you're new to my practice, welcome. Thanks for joining me. And if you have any further questions, I'd be happy to answer them. Please contact me at my office number. I hope to see you as a friend and a patient in the future.